Today's webinar will cover the qualifying events that trigger a special enrollment period, as well as the eligibility criteria for various SEPs and the new low-income SEP. Finally, we'll cover the timing and coverage effective dates for different SEPs. Today's presenter here at the Center on Budget and Policy Priorities is Sarah Lueck, Vice President for Health Policy. And with that, I'll turn it over to Sarah.
Thanks, Ina. Hi, everybody. I'm happy to be here with you today. As Ina mentioned, we're going to be covering a lot of different aspects of special enrollment periods because it is special enrollment season. On the list, as you can see on the screen, an overview is what I'll give you first of special enrollment periods. And then I'll go through various types of events and circumstances that make somebody eligible for a special enrollment period. First, more common events, and then less common events. Then you'll hear about the process for accessing SEPs, a little bit about SEP verification at the marketplace, and restrictions on plan choice for people that are already enrolled in marketplace coverage. So let's get started. First, the overview. This structure of an open enrollment period that you're all familiar with, that in this case, the most recent one for 2022 lasted from November 1st through January 15th in those states that use the healthcare.gov platform. Those are the yellow squares, those dates. And once that period is done, we move into a period where people need to have a special enrollment period in order to enroll in coverage. And if you're in a state with a state-based marketplace, it's worth being aware of that. Those may have different, longer open enrollment periods and different rules about some of the details around special enrollment periods. So anytime that somebody's eligible for a special enrollment period, they can switch marketplace plans or enroll in the marketplace for the first time. And we'll go through the various events in a bit. The major categories of events that qualify you for an SEP, the main one is loss of other coverage. So people who lose their job-based coverage or Medicaid, when people's households change, so they get married or they give birth to or adopt a child, they move to a different place, either within the US or they come in from another country. People experience changes in eligibility for financial help. And then there's some less common SEPs about plan errors or other kinds of errors by brokers or misconduct, things that might go wrong on the website, and then some of the other circumstances that we'll talk about, like the ability of survivors of domestic violence or people impacted by FEMA disasters to be able to enroll in coverage using an SEP. So the timing of SEPs, they're usually available for 60 days after this qualifying event or triggering event, although some SEPs are also available for 60 days before the qualifying event, which is what we call advanced availability. The effective dates for coverage, there's different effective dates for different SEPs. Don't get too worried about knowing the differences. You'll see on our some of our tools that you'll be able to keep track of this much more easily. But just in general, the regular coverage effective dates are that if somebody selects a plan at the marketplace between the 1st and 15th of the month, the coverage becomes effective on the first day of the month following that plan selection. Whereas if somebody selects a plan in the latter half of a month, the coverage is effective on the first day of the second month following plan selection. For example, if someone selects a plan on February 21st, coverage will begin on April 1. But as I mentioned, there's some of the SEPs, including some of the more common SEPs, that might have more prompt coverage effective dates. In some cases, people can use an SEP, but they must both experience a qualifying event and have had minimum essential coverage at least for 1 day during the prior 60 days. The rationale for this is that, in some cases, there's just an effort in the federal rules to kind of create a structure where people are not always able to get into coverage when they've been uninsured. So some SEPs will allow people who are uninsured to get access to coverage using that SEP, but other SEPs require the person to have had prior coverage. When there's a prior coverage requirement in place, we will note that in this webinar and in the chart, that we use as a tool. But if there are exceptions when there is a prior coverage requirement, people who are moving into the U.S. From a foreign country or a U.S. territory in the past 60 days don't have to meet that prior coverage requirement. Or if the person is a member of a federally recognized Native American tribe or an Alaska Native, those folks would not have to meet the prior coverage requirement. This is really exciting piece of information that we're excited to share with you today. New for 2022 is that there is an SEP available to people who have incomes no greater than 150% of the federal poverty line. This is a really important way for folks who have low incomes and who are eligible for significant amounts of subsidies, so both premium tax credits to help them afford coverage in the marketplace and cost sharing reductions that reduce their deductibles and their cost sharing under their plan, letting those folks that have significant subsidies available to them to be able to enroll, even if in some cases they are uninsured and they're just finding out about coverage, they've missed the open enrollment period and they need coverage. This is something that could be available to them, and that is very good news. So folks, an individual who's at 150% of the federal poverty line has income just over $19,000 for the year. So the person has to be expecting that that's going to be their income, that their income's not going to exceed that level. They have to be otherwise eligible for premium tax credits. They don't have to have prior coverage. As I said, this is available to folks who have been uninsured. And this SEP does allow people to newly enroll in a QHP or for a current enrollee to change from one QHP to another. And that ability exists one time per month. So it's a little bit different than most of the other SEPs. Under the federal rules as they're written now, this particular SEP is only available in years when enhanced or increased premium tax credits are allowing people with income up to 150% of the poverty line to buy a silver plan, the benchmark plan, the second lowest cost silver plan, for a $0 premium. So without having to make any contribution toward that premium because of their income and because of the access to the enhanced PTCs. Under the American Rescue Plan that was passed by Congress, enhancements to the premium tax credit do ensure that everyone right now has access to a $0 plan if they have income under 150% of the poverty line. So for now, in 2022, this SEP is available, but as the federal rules stand, it will not be available unless if the tax enhancements expire after 2022, which will happen unless Congress acts to extend them. So, that is a really important ability for folks to access coverage. It's not exactly forever, so we'll have to wait and see what happens in Congress. So let's dive into the common events that trigger a special enrollment period. As I mentioned, loss of other qualifying coverage is the major event. A majority of the people using SEPs are losing other coverage. They might be losing eligibility for an employer plan. For example, if they lose their job, quit their job, or they have their work hours reduced by their employer and are not eligible for that benefit anymore. This includes people who are losing eligibility for Medicaid or CHIP. It includes cases when a plan is canceled, not by the individual. Voluntarily canceling your plan does not qualify somebody as losing other coverage, but if the insurer or the plan sponsor cancels their plan, that would qualify them for this SEP. People may also be losing eligibility for a student health plan if they're a student at a university or a college. They may be losing pregnancy-related Medicaid coverage or medically needing Medicaid coverage, or they may have a plan that's expiring at a different point in the year than on the calendar year. So if, for example, they're enrolled in the individual market or in a small business plan that runs on a different calendar year and they're losing that plan, they can come into the marketplace because they're losing that coverage, even if they have the ability to renew it again. So let's look at how this can work in practice for someone losing other health insurance coverage. This is Joe and Danielle. They are enrolled in a health insurance plan that Danielle gets through her job. Danielle quits her job in May, and her insurance is scheduled to end on May 31st. And she has the opportunity to get COBRA and continue her employer coverage, but it costs a lot of money. So Joe and Danielle are eligible for an SEP, and they decide they're going to look into the marketplace coverage. They have 60 days before and 60 days after Danielle's employer coverage ends to pick a plan in the marketplace. And in this example, where you see the arrows below, you can see that Danielle's quitting her job on May 6th. Her coverage ends May 31st. They actually use that advance availability and pick a plan on May 16th. And the good news there is that then lets them seamlessly start coverage without any gaps on the marketplace starting June 1. So how would that look differently if they did not pick coverage right away? So in this scenario, you can see that they don't pick a plan until the end of July. They're still within their SEP window, so they are still eligible for the SEP, and they are able to get coverage, but unfortunately they do have a gap in coverage. So this is just to show that knowing about that advance availability is really helpful for folks that want to avoid a gap in coverage, and planning ahead and getting through that process before the other coverage ends can be really useful. So let's look at changes in the household size. Different SEPs that fit under this would be getting married and having a baby, adopting a child, or placing a child for foster care. And with marriage, it's important to note that there is that prior coverage requirement that I mentioned. So at least one of the spouses, they get married, but at least one of them has to have coverage in the prior 60 days for at least one day, or they need to be living in a foreign country, so not really eligible for coverage in the US, or AIAN. With birth and adoption, and you can see at the bottom here, oops, I'm so sorry, my mouse is acting funny. You can see at the bottom the effective dates. These are examples of SEPs that allow folks to have more prompt beginning of their coverage, and including in the case of birth, adoption, and foster care placement or court order, retroactively to the date of the SEP event or the first day of the month after the SEP event. So let's look at an example of marriage SEP. This is Jay and Kim. They get married on July 12th. Kim had coverage through her job previously, and Jay was uninsured. Kim dropped her coverage on May 31st before they get married. So in this case, voluntarily dropping her coverage, remember that is not going to on its own trigger, that's not going to trigger an SEP. That's not the same as getting her plan canceled. But then after that happens and they're uninsured, Kim and Jay get married, and that triggers an SEP. On July 17th, Kim and Jay selected a plan, and on August 1, coverage begins. In this case, she is eligible. They are both eligible for this SEP because Kim has managed to get the new coverage in the marketplace and use her SEP while she's still covered by that prior coverage. She has had coverage for one day in the prior 60 days, so she's able to access that marriage SEP. But what if Kim dropped her coverage earlier? So in this scenario, she voluntarily drops her coverage, but this happens on April 30th. That doesn't trigger an SEP. And that's 73 days before they get married. So they get married on July 12th. But because that's more than 60 days, they are not eligible for an SEP in this case. So waiting too long after having that prior coverage can make people not able to access that particular SEP and those SEPs that have the prior coverage requirement. Now, looking at how this new SEP works, we thought this would be really important. This is an example of how the new low-income SEP for folks who have income up to 150% of the poverty line would play out in reality. This is Jane. She is uninsured and lives in Nebraska. She earns $19,000 per year, so that is under the 150% federal poverty line cutoff for this SEP. She recently found out that there was that she could access a plan at healthcare.gov that would cost her $0 per month. So finding out that information, she's uninsured, and she goes to healthcare.gov and starts an application. You can see a little picture there of some of the key information. She's putting her income in, and we find out here that she's uninsured. She's reporting that. And it turns out she is eligible to buy a marketplace plan. She's eligible for a significant premium tax credit, and she is eligible for very significant help with her deductibles and other cost sharing, because she can get cost sharing reductions. So if she enrolls in a silver plan, she'll get that help as well. So that is good news for her. And you can see that this is a important new pathway for people in 2022 to access this really significant marketplace assistance. Now, permanently moving to a new place, if you are gaining access to new plans as a result of that move, does trigger an SEP. But this is another one where the prior coverage requirement applies. So the types of moves that would fit with this SEP would be moving within the same city or the county or the state, but as long as there are different plans available, that's a move. Somebody moving to another state where they're, having to come into another marketplace, a child or other dependent that's moving back to a parent's home, a student who's been attending school and then moves to that new location or back home from that location, people who are moving for seasonal employment but are maintaining another home elsewhere, such as a seasonal farm worker, and people moving to or from a shelter or other transitional housing, as well as folks moving to the U.S. after living outside the country or in the U.S. territory. So for those people moving around within the country, they will need to have had prior coverage within the 60 days prior to the move, or be AIAN, and that prior coverage requirement doesn't apply. Let's look at that situation and how that would work in practice for this family. This is George, Marie, and Amina. They live in Illinois. They were all enrolled in coverage through George's job, but that coverage became too expensive. They voluntarily dropped it at the end of May. And then Marie gets a new job in Ohio, and the family decides to move there in early July. They are eligible for the SEP triggered by a permanent move, because in this case, they did have coverage in the last 60 days. So let's talk about different types of, sorry about that, y'all, changes in eligibility for financial assistance that can trigger an SEP. People can be found newly eligible or ineligible for premium tax credits, and that can trigger an SEP. So that would be a change in income or a change in household size that makes an enrollee or an enrollee's dependent newly eligible or ineligible for the PTCs. And that is triggered for folks who are currently enrolled in a QHP. There's also a SEP triggered for changes in cost sharing reduction eligibility, CSR eligibility. People may experience changes in income or household size that changes that eligibility, and then that would include cases where people are moving between CSR levels and losing or gaining eligibility for CSRs. And then people can become newly eligible for PTCs after decreased income. This is for folks that have had at least one day of coverage in the past 60 days, but they experience a decrease in household income and are determined newly eligible for PTCs. Some of the less common events that can trigger a special enrollment period. Enrollment or plan errors are one example of this. This could be errors, misconduct, or inaction by the marketplace, HHS, non-marketplace entities that help with enrollment. So, these are cases where people were not enrolled in a plan, or they chose the wrong plan, or they did not get financial assistance they were qualified for because of someone's error, misrepresentation, misconduct, or inaction, or they experienced some kind of technical error that either prevented their enrollment or prevented their insurer from receiving their enrollment information. Other kinds of errors would be plan or benefit display errors, when they're seeing information about a plan and then that influenced their decision, but that is incorrect information. And then health plan violation. So when an insurer substantially violates a provision of their contract. This is a less common thing, and the effective date is appropriate to the circumstances. So these are situations where people really have to kind of show that they've experienced one of these errors or violations or misconduct. Some of the other circumstances that qualify people for an SEP are being determined eligible or ineligible, being determined ineligible for Medicaid or CHIP. So these folks would apply for Medicaid or CHIP during open enrollment or during an SEP, and the agency determines them or their dependent ineligible for Medicaid after the enrollment period ends. And this is available regardless of whether people apply through the marketplace or directly through the state Medicaid agency. Or people may need an SEP because they've been detained, sort of resolving a data matching issue, and they have a DMI that's resolved after their coverage is terminated due to the end of the initial inconsistency period, or they have income under 100% of the poverty line and did not enroll in coverage while they were waiting for the verification of eligibility based on their immigration status. So let's look at an example of that. This is another family, sample family, Roberto, Monica, Alex, and Elena. Roberto and Monica are married and they have 2 children. When they apply for coverage, Monica gets a data matching issue and is asked to send documentation in to prove her citizenship. The documentation she sends is insufficient, so her coverage is terminated at the end of March. In April, she sends in more documentation and her DMI is resolved on May 14th, and that triggers an SEP. Some of the other circumstances I mentioned: survivors of domestic violence or spousal abandonment. This is when someone experiences domestic violence or spousal abandonment and wants to enroll in a health plan separate from the person that abused them or their spouse. This applies also to dependents who can enroll in the same plan, so that would be maybe children. The SEP is only triggered if the person is currently enrolled in coverage. And then there's other exceptional circumstances that prevented people from enrolling when they were able to, when they should have, maybe during open enrollment. So like a disaster, a serious illness that puts someone in the hospital, or somebody winning an appeal with the marketplace. There can be cases where those result in exceptional circumstances, SEPs being granted. So just to review a bit, what does not trigger an SEP at healthcare.gov? Voluntarily dropping other coverage is one important example, or losing eligibility for coverage when somebody was not enrolled in it. So for example, if somebody loses their job, but they didn't sign up for their employer's health plan, they didn't have it before, that is not going to trigger an SEP when they lose their job. Being determined newly eligible for subsidies doesn't necessarily let somebody into the marketplace. This new low-income SEP will let some lower-income folks in the marketplace when they are, determined eligible for PTCs, but people with higher incomes than that who are uninsured are not going to automatically be able to get marketplace coverage just because they apply and find out that their income makes them eligible for premium tax credits. Being terminated from other coverage for not paying their premiums will not allow somebody to then immediately go into the marketplace. And on its own, divorce or the death of a family member does not trigger an SEP unless the person also loses other coverage because of that, loses access to coverage that they had maybe through that family member. But however, there is an exchange option for state-based marketplaces to implement this sort of SEP for divorce or death of a family member, as long as the person is enrolled in a QHP. And then becoming pregnant at healthcare.gov does not trigger an SEP, although having a baby does. But several of the states that run their own state-based marketplaces have made becoming pregnant an SEP trigger. And that's something that SBMs have the flexibility to do. All right, let's look at an example of this. This is Carla. Her employer offers coverage, but she does not enroll in it. So She finds out in May that her employer is reducing her hours and she's no longer eligible for employer coverage. Her income's going to drop because her hours are being reduced. And she no longer has the offer of coverage from her employer. So if she had been enrolled in that coverage, she would be able to get access to a marketplace SEP. But in her case, the situation does not trigger an SEP. So just having your work hours reduced and having your income drop if you are not enrolled in other coverage is not going to trigger an SEP all on its own. Now, if Carla did have income that was 150% of the poverty line or lower for that year, then she would be able to get access in 2022 to that low income SEP that I've been talking about. So in this case, her income goes down on May 3rd and it doesn't trigger an SEP. So she's going to have to wait until the next open enrollment period to sign up for a plan. And that coverage would then start January 1. All right. Ina, could you tell me if you can share any questions that folks might have so far?
Thanks, Sarah. Yep, there are quite a few questions. So let's start with a simple one. If someone's Medicaid application is denied outside of open enrollment, would they be eligible for an SEP?
Yes, there is an SEP for when folks are denied Medicaid. Just finding my handy dandy reference chart. Yes, there is one available to them, and they should go and apply. Once they're determined ineligible for Medicaid, they are eligible. They are, yes, the person has to have applied during open enrollment, and the state Medicaid the person applied for Medicaid or CHIP coverage during open enrollment or during another special enrollment period, and the state Medicaid agency determines them ineligible for Medicaid after the open enrollment period ended, then the person would be able to get an SEP in the marketplace. And this applies regardless of whether the person applied directly through the state Medicaid agency or applied through the marketplace and had that information transferred to the Medicaid agency.
Great, thank you. Let's see. If someone has a plan through their job, but they leave the job and move to another job that doesn't offer insurance, are they eligible for an SEP?
Right, so are you, sorry, I didn't hear all the question. Did the person have the coverage through their prior job?
Sorry about that. So the person had employer-sponsored insurance, moved to another employer who didn't offer insurance. Would they then be eligible for an SEP?
Yes, that would be considered a loss of other coverage when they leave their job and lose that plan that they had. That is going to trigger an SEP for loss of other coverage.
And if someone's eligible for the under 150 FPL SEP, are they required to buy a $0 premium plan?
No, they are not required to buy a $0 premium plan, but because of the way the subsidies are structured, they're going to be eligible for a silver plan that is a $0 premium plan, and that is going to have a cost sharing reduction associated with it. So it's likely that they are going to be best off choosing that plan because it's going to have an extremely low deductible, along with the even maybe very minimal cost sharing, because that person will also be eligible for the cost sharing reduction. So the $0 premium plan in the silver level is going to probably be the best bet.
And going back to the getting married SEP, does it only apply to people who had coverage before the marriage?
So there is a prior coverage requirement. So one of the people getting married will need to have had coverage in the 60 days for at least one day within the 60 days prior to the marriage in order to qualify for the marriage SEP.
If a person is insured but their income is below 150% of the FPL, are they eligible for an SEP?
They're insured. Sorry, I didn't hear that part.
Yes, they're insured through the marketplace. Can they get the SEP and change plans?
Yes, the low income SEP that we've been talking about is available to current enrollees, but there are going to be some plan choice restrictions, so restrictions on which plan they could change to, that we'll talk about a little bit later after we're done here.
And is the low-income SEP expected to end at some point?
So it won't be in effect after this year. So it is available right now so that's the important thing for people helping plans right now. It is in effect, but it really is tied to the enhanced premium tax credits that were part of legislation called the American Rescue Plan. And those enhancements that made the premiums really more affordable for folks, and particularly made $0 premiums available to people up to 150% of poverty in the marketplace. Those are temporary under the American Rescue Plan. They are only in place for the years 2021 and 2022. So at the end of this year, unless there's an extension, done legislatively in Congress, that those enhancements will not be available anymore. And right now, the way the federal rules are structured, that low-income SEP won't be available anymore.
And what about a person who reduces their hours to part-time and loses their employer coverage because of that? Are they eligible for an SEP?
Yes, that also fits under the definition of losing other coverage, because they are having kind of a change in their employment that then causes them to not be eligible for their employer's benefits anymore. And that loss of eligibility means that they would be able to get access to an SEP in the marketplace.
Thank you so much, Sarah. And we will continue to take questions again at the end. So please keep them coming.
Great, thank you. Okay. So let's just talk a little bit about the process for accessing SEPs. If the person is already enrolled on a marketplace plan, all they have to do is return to the marketplace application and quote unquote report a life change. There will be a place to click for that. And they can then go through the application and edit information that has changed. If the person is not enrolled in a marketplace plan, then they just have to go to the marketplace and start a new application. Once the application is completed or updated, the eligibility notice will inform the person whether they are eligible for an SEP. If they are determined eligible for an SEP, they will then be able to switch plans or newly enroll in a plan during the SEP. So, and note here, some of the SEPs are available through the application, but some are granted only by the call center. So that's important to know. And here is what the reporting changes looks like on healthcare.gov. People who enroll in a marketplace plan have to report changes on their original application. The kinds of changes they should report are changes to their income during the year, changes to their household, moving to a new address. If they're moving out to a new state, they're going to need to complete a new application in the new state, and then changes in status like tax filing or citizenship or immigration status. And some of those changes, when they report them, will trigger an SEP, but not all of them. And some changes will result in an adjustment to the amount of the premium tax credit the person is eligible to receive. SEP verification. In general, SEPs are self-attested to on the application, just like a lot of other information. But some of you who have been doing this work in the last few years will remember that there's also been a system of pre-enrollment verification in place since about 2017. But that is changing. This is new in 22. So what this is called is a SEP verification issue. Some people who complete a new application on healthcare.gov outside of the open enrollment period may be required to submit documents. They won't just be able to self-attest. They will have to submit some documents to prove they're eligible for an SEP before they can enroll and before they can use their coverage. So this is called an SVI, but in prior policy required that this pre-enrollment verification be conducted for a number of different SEPs, such as a permanent move or the marriage SEPs. Now the federal government is scaling that back in healthcare.gov, and effective in July 22, under a recent rule change, pre-enrollment verification applies only to the loss of coverage SEP. That is still the most common SEP, so your probably still going to see this, but it's scaled back to a different level. So it's not as many of the SEPs that folks are going to use. The reason for the change that the federal government gave when it made the rule change recently was that having to provide documents has presented a barrier to enrollment for applicants. Some people didn't complete their enrollment, even if they were eligible. And their data showed that applicants who are Black and applicants who are younger were among the demographic groups who were less likely to complete the process when they were made to submit documentation. So now people will generally, again, be attesting to their eligibility for SEPs. And when a new applicant attests to the loss of coverage SEP, there will be this potential for a pre-enrollment verification. Healthcare.gov will use electronic data sources to automatically verify SEP eligibility when possible. So they'll be looking for other information without involving the applicant to try to verify that SEP for losing other coverage. And then if that doesn't work, some applicants will be asked to provide documentation, and they will have 30 days to do that after they select a plan at healthcare.gov. Once the eligibility is verified, the file for that person, that enrollment file, will be sent to the insurer, and then the applicant will need to pay for their first month's premium for coverage in order to make it effective. And this is the policy that I'm talking about, and the verification process I'm talking about really does apply in healthcare.gov. State-based marketplaces are not required to do this. They do different types of verification and have different practices. People who are working in those states should be familiarizing themselves with those separate practices. When there is a loss of coverage SEP and it has been verified, the coverage will generally begin on the original coverage effective date. And again, the applicant has to pay the first month's premium to make sure the coverage becomes effective. If the verification issue is resolved after the original coverage effective date, coverage will begin retroactively. The insurer will be responsible for paying claims on any covered services in that retroactive period. And if a verification issue is resolved more than 2 months from the original coverage effective date, the person can choose to have coverage to begin 1 month later than the original effective date. So I think we'll be very interested to hear from all of you whether you what the experience is like with some of the changes that have gone on in terms of people's verification for this SEP for losing coverage. And I'm just putting this chart here as reference. I'm not going to go through it, but there are different types of points in the process where people maybe will need to provide some different information or have an issue where the marketplace healthcare.gov is asking them for documents or asking them additional questions. And these have different deadlines and different impacts on people's enrollment. So this chart is here for your reference as you're thinking about the differences between identity proofing, data matching issues, and SEP verification issue. And I mentioned in one of your response to one of your questions earlier that there are restrictions on plan choice for current enrollees. So when a new person comes to apply to the marketplace, they are able to pick any plan. But in some cases, when a existing enrollee gets an SEP, they're not going to be able to just go into any plan that they want. For most SEPs, a current enrollee would only be able to change plans within the same meta level as the plan they already have. There are some exceptions. If there are no other plans available within that meta level for the person to change to, they can enroll in a plan one meta level higher or one meta level lower. And then for folks that are experiencing a change in eligibility for cost sharing reductions, so that's the financial assistance that reduces people's deductibles and other cost sharing, people can use that SEP to change to, even if they're current enrollees, they can change to a silver level plan if they don't already have one, because that's to make sure that they can access the cost sharing reductions. Cost sharing reductions are only available in silver level plans. So this is to allow folks to access those. Or they're able to change plans within the same meta level that they already have. So somebody who's in a bronze plan and has an income reduction that makes them eligible for a more generous level of cost sharing reductions, they would be able to then change into a silver plan if they wanted to, in order to get access to that, or if for some reason they wanted a different bronze plan, that would be available to them as well. Okay. New in 2022 is that enrollees who have a silver plan and then become ineligible for cost sharing reductions, so their income goes up and they're no longer eligible for that extra help, they could use their SEP to change plans out of the silver level. They could get a bronze or gold plan if they chose to. And then folks who are already enrolled in the marketplace and who qualify for an SEP because they are getting married or because they're giving birth or adopting or gaining a foster child in their family, they will only be able to add that new spouse in the case of marriage or other dependent like a child to their current marketplace plan, or they could have that new spouse or their new child or dependent enroll in any plan separately. So the new enrollee, whether it's the spouse, the new spouse, or a new child, could enroll in any plan they wanted to. But if they're gonna, they could also just join the plan that their other family member is already on. There is an exception here as well. If an enrollee's current plan doesn't cover spouses or children or certain types of dependents, then the enrollee and the dependent can enroll in a new plan together within that same metal level that the person already has. So the purpose of these rules, which seem really complicated when you talk about them out loud, is to try to limit the ability of enrollees during the year outside of open enrollment to switch to different plans that are very different from their own plans. I think in practice, it's good to be aware that these exist, but you don't have to know all of the details. The website will tell people what their plan choices are, but we have had instances where folks are confused or questioning why a person can't change to a certain plan, and this is most likely the reason, that they're already enrolled and there are some restrictions on their ability to change during the year. Of course, once it's open enrollment again, if they're still going to be a marketplace enrollee, that's when they have the ability to change to any plan that they want. All right, and then just to note, there are SEPs that are not going to have those same restrictions on plan choice. So there is a special enrollment period specifically for American Indians and Alaska Natives that does not have a restriction on plan choice. Any of those errors or mistakes that I mentioned, those kinds of less common SEP triggers, like errors by the plan or misrepresentation or by the exchanges, and other exceptional circumstances, people will be able to access other plans if they meet the criteria and turn out to be eligible for those. And similarly, the survivors of domestic abuse or spousal abandonment that we talked about before. And Ina, let's see if we have any other questions.
Thanks, Sarah. Definitely a lot of questions. So let's talk about the 150 FPL SEP first. When does the SEP become available?
So it is available right now. I'm really glad we're getting so many questions about this because I really am hoping that this is super useful to folks who are in need of coverage. It is available now. It became available a little earlier this year, and it is available on the website. So it should be able to be accessed by somebody you're working with. You know, if you want to start an application on the website, you should be able to access it, just like in that example that was in the slides of Jane and her application. So it's available right now, and it's available for the rest of the year. So get it while you can.
And if a person has income below 150, but their employer offers insurance, can they still get the 150 FPL SEP?
If their employer is offering them coverage that is affordable and adequate, so under the standards of the ACA, then they are not eligible for premium tax credits. And in order to access this low income SEP, you have to not only meet the income standard, you also have to be eligible, otherwise eligible for premium tax credits. So in a case where somebody is being offered an employer plan that is technically affordable to them and technically meets the minimum value standard of the Affordable Care Act. They are not eligible for premium tax credits. They would not be eligible for the low income SEP.
And do people who don't have prior coverage, can they still get the 150 FPL SEP?
Yeah, this is like one of the most important parts about this, I think. So yes, people who are uninsured and don't have other coverage and haven't had other coverage. So there's no need with this SEP to show that you've had prior coverage, like some of the other SEPs we talked about, where you have to have had coverage within the last 60 days. For the low income SEP, this one that is for folks up to 150% of poverty, it is available to people who are uninsured. And the idea here is that this is a really important way for people who maybe didn't know they were eligible for marketplace coverage or didn't know that they could access the significant financial help that's available. This is a way in for them. So it's really good to try to get the word out and make sure people understand that it's available, because there is such a significant amount of help available for folks.
Some of the SEPs had a 60-day window. Does the new SEP for 150 FPL have a window timeframe?
Not exactly, no. I was interested to see that the eligibility determination that came back on our example person, Jane, did say she had to meet a deadline that she would otherwise risk losing her SEP. But you'll see in the resources, so I'll just know that there isn't really a deadline because the SEP is really available once per month. So if somebody for some reason didn't work for them, or they didn't get it done, or whatever happened in 1 month, they could try again, even if they miss that 60-day window. So some more detail about this is available in one of the links in our resources, which is a fact sheet about the low income SEP that you can consult for more details about all of the ins and outs of this. But even though that message back from the healthcare.gov website made it sound like the person had to enroll then, it isn't exactly correct. So I think the answer is it's best for the person to go ahead and enroll because they're eligible for a $0 premium plan. And if they're applying, they probably want coverage. So it's best to try to move forward and make sure that they get it as soon as possible. But if for some reason something comes up, that is an SEP that's available once per month.
And going back to the Medicaid denial, if someone applies for Medicaid outside of open enrollment and is denied, does that qualify them for an SEP?
No, I don't believe it does.
Let's see. And if the person knows.
Sorry, so I guess the caveat that I would have there, is that if they're low income and they potentially would meet this low income SEP, I think that would be important. So the denial of Medicaid in and of itself doesn't create an SEP, but there are other SEPs that might be available to the person in that situation.
Thanks for that. Let's see. And if a person knows they're going to lose coverage, can they get an SEP before they lose coverage?
Yeah, for sure. The one with loss of other coverage is available in advance. So if they have coverage, so they know, they have their job-based coverage or they have Medicaid coverage and they know they're going to lose it. It's the job-based coverage that's available ahead of time in advance. So that is a situation where people do sometimes know in advance that they're going to be leaving their job and they will know when their coverage is going to end. So that's definitely an important one to line up the new coverage in advance. And let the marketplace go ahead and apply at the marketplace and let the marketplace know when you're going to be losing that coverage so that the new coverage can be effective on time.
I mean, if a person becomes newly eligible for cost sharing reductions, can they switch plans within their meta level only, or can they switch to a platinum or gold plan?
This is a good flashcard. Let me go back to the slide. I don't want to waste everybody's time with my mouse. It's not working. Here we go. Sorry, it's not working right now. I think they will be able to make changes one level up or one level down, but I can't remember off the top of my head, so apologies.
Totally okay. We'll send out the answer with our recording and resources. And we can take a couple more questions. Can you briefly cover what kind of documents a person might have to submit to verify their SEP eligibility?
Yeah, so if you do have a situation where someone is asked to verify their loss of other coverage, Some of the documents that might be important to have on hand or to have the person look for would be, for example, if they're losing employer-sponsored coverage, they may have a letter or other kind of document that they either have or could get from the employer or the insurer that notes when the coverage that the coverage is terminated or that it will end at a certain point. If the person is losing Medicaid coverage, there will be notices from the state agency letting them know that that's happening. So any of those kinds of notices would be important. And I believe we have some links to that in our resources. We do. In this page, additional resources under documenting loss of MEC, there's some examples and some details about the kinds of documents that would be helpful to submit and that would help document that loss of other coverage.
Two more questions here. If someone is leaving an abusive partner and wants their own insurance, are they subject to the previous coverage requirement to get an SEP?
Yes, I believe they are. They would have had to have other coverage, but they can enroll in order to get coverage on their own.
And last question, are all plan start dates effective the first of the following month as long as the plan is chosen by the last day of the previous month?
The first of the following month? No, not all. Some SEPs are available the first day of the following month of the event, the first day of the month following the event, and then some coverage will be effective based on those quote unquote regular coverage effective dates. Excuse me. And in that situation, if somebody enrolls in the last day of the month, then their coverage will be effective the first day of the next following month. Second following month, sorry.
I lied. There's one more question we can probably take. If someone loses the Medicaid coverage during the year due to an income increase, will they qualify for an SEP?
Yes, if someone is terminated from Medicaid because they're not eligible anymore, then they will, that is a loss of minimum essential coverage, and they will be able to go to the marketplace and apply for a plan.
Thank you so much. And thank you everyone for the great questions. I'll turn it back to you, Sarah.
Great. So I'll just note a couple of the resources that we have available here and are linked to in your slides. So the SEP reference chart is a good way to, it's a good tool to use if you're working with folks and you have a really specific situation and you're trying to understand if the situation that your client or the applicant has might qualify them for an SEP. So we've tried to be as comprehensive as possible here. You can see it's about 10 pages or 11 pages long by now, and you can see that you can look on the left-hand side for a qualifying event and see if that suits any of the situations that that person is dealing with, and then you can get other details about that SEP, such as whether the person has to have had prior coverage and how the SEP is granted, whether it's on the application and you just go online and get it, or whether you need to call the call center or work with CMS. Another important set of resources comes from Community Catalyst. There's a lot of important outreach materials at this link that are editable and that are available in a number of different languages to help inform people about different SEP triggering events and how to access coverage. And then here are a number of links that will provide more details about some of the things we've talked about today. So there's some information from healthcare.gov about different SEPs and a list of SEPs for some complex issues. Those are some of the less common SEPs that we touched on today. More detailed information about the new low-income SEP, which it sounds like some of you would be very interested in finding out more about. And then the fact sheet on the most recent marketplace rule, also called the Notice of Benefit and Payment Parameters, that talks about some of the verification changes for SEP verification that I mentioned. And then the link to some sample marketplace notices, and including this documenting the loss of MEC, which is relevant if someone is asked to show documentation that they've lost other coverage. And then a tool from Beyond the Basics about employer coverage and premium tax credit eligibility that can be really useful for people dealing with that situation. And Ina, I think that's the end of our presentation. Here's our contact information. And I'll turn it back to you.
Thank you, Sarah. As a reminder, we'll be distributing the materials from today's session via email next week, and we'll post everything to the Beyond the Basics website. You can also find the additional resources we have in this presentation on the website, and some frequently asked questions, guides, and other reference charts. If you have questions or need assistance, please email us at beyondthebasics@cbpp.org. And with that, we'll bring today's webinar to a close. Thank you again for joining us today.